Good day, I'm Bimfernifer and now I'm going to do the procedure which is the checking the CTT, which is the chest tube thoracostomy. So before doing the procedure, make sure that you gathered all your supplies, which is the stethoscope for assessing the lungs, then the micropore, the gauze, and the normal saline. So um after gathering all the supplies, check the client's record and the doctor's order to make sure that we have the right patient and the right procedure. So let's start. So now we're here in the patient's room. So before entering the room, make sure that you wash your hands and also you wear your gloves. Then first things first, introduce yourself to the client. So good day, ma'am. I'm Fernelyn, your nurse for today. So may I know your name, please? So identify your patient using two identifiers, which is the um get the patient's name and birthday. So, ma'am, may I know your name and birthday? Then check her band name. Okay. So when we have the right client, let's now explain the procedure. So, ma'am, I'm going to check your chest tube, and then I'm going to check if there's any drainage or yeah. So let's start. So hello, ma'am. Are you having any pain right now? Okay. So now I'm just gonna check your chest tube and your lung sounds. Okay. So make sure that before we pull the cover of the patient, make sure that we provide privacy and also we get the consent. So ma'am, I'm gonna pull your cover. Is it okay with you? Okay. So I'm going to pull the cover and then I will expose the area. So ma'am, I'm going to assess your lungs. So take a deep breath po. Okay. So we can hear some diminished sounds, which is expected po because of the chest tube. Okay. Okay, so after assessing the lungs, um, let's check the site. So make sure that the gauze is dry and intact and there is no drainage, and make sure that the tape is secure and tight to the body. So let's go down po to the tube. So check po natin yung connection ng tube, then check po natin if there's any clogged or damage po sa tube. Then make sure that the connection is good. So after checking po the connection, so make sure that the connection is good, then check po natin yung suction if it's on. Then if it's on and continuous, then as we can see, if I remove this suction, the bellow will disappear po. So when I reconnect naman po itong tube na tinanggal ko, mag-reappear po yung bellow. So the pressure that is done by the position order only. So next is the water chamber, which is this one. Make sure that the water level is equal to the water meter. So right here. So if it's not, then add or remove water. So check din po natin for bubbling. So if there's any bubbling, we don't want that. So if there's any bubbling, it means that we have a problem in the connection of the tubing. So also in the breath sound, you will rise and fall of the water level. So the drainage system here, this one, so never empty this, because it is a continuous collective of drainage. So with each shift, you will mark this with the use of either tape, or you will mark it, then ilalagay niyo po ng date and time. So and also make sure that beside your table po, make sure that you have your tape, micro tape, then normal saline, and also sterile gauze. So in normal saline, you will use it when the tube detach and you want it to submerge it to the saline, so that it can be sterile again and clean as possible. So the gauze, you can use it when the chest tube get dislodged. So the monitor drainage system here, you can hang it into the lower part of the bed. So make sure that it is beside or malapit lang po sa bed ng ating patient. So once I'm done with the procedure, ask po natin yung patient if meron po silang kailangan sa atin. So ma'am, do you need anything po? Okay. So ma'am, do you feel any pain right now or in the side po? Okay, ma'am. So make sure that you leave your patient in a comfortable and more secured and in a comfortable position. So ibalik po natin yung cover, and then ma'am, just call me po sa nurses station, or you can press the bell po if you need anything. Thank you po, and thank you for your cooperation. So after that, after you gathered all the materials that you use in the procedure, dispose what are the things that need to be disposed, and then make sure that you remove your gloves, and then you wash your hands and remove your PPEs. And then after that, don't forget to document all the data that we gathered in this procedure. So that's all, and thank you for watching.